I'm Dr. John Gill. I'm an infectious disease specialist and I'm the medical director of the Southern Alberta HIV program in Calgary. Well, I think you need to not just look at the laboratory tests that we've been trained for the last 20 years. We see an HIV patient, we look at their viral load, their CD4, we may look at their kidney function and their cholesterol levels, but I think we've got to think more holistically now. We need to look at their social environment. Have they got stable housing? Have they got a job? Have they got food security? Are they safe in their environment? Are they socially isolated? And that's one of the new components of chronic HIV management. And then we need to look to see what other problems medical they have, often associated with aging, to make sure that we coordinate with other caregivers. Certainly now we've got to co-manage comorbidities such as hepatitis C, neurocognitive decline, perhaps from Alzheimer's disease, diabetes management. It's becoming a complex medical management with the aging HIV patient. I think we're seeing increasing comfort and recognition that this is something we cannot do the ostrich approach. Put our heads in the sand, hope the patients will tell us if it's important. We need to be a tad more proactive. And certainly in Ontario, more doctors are doing it. I know several other clinics that are feeling increasing comfort in actually addressing this very delicate issue with their patients. Then, of course, we need to figure out what we do with the information. Sometimes you have to extract a patient from a very unsafe home environment. Other times you need to help them maybe with counseling or just understanding how it helped them get over a previous traumatic event. But you can't deal with it unless you know it's there. Well, one of the questions in one of the concurrent sessions was culture. There was a lady who said in some cultures, a little bit of physical violence is norm. It's been norm in that society for centuries. Should we impose Western Canadian values and say that's totally unacceptable? And that is delicate because you don't want to extract someone from their community because of a value that they're not really, if they're not, life's not in danger and it's a bruise here or there, if they're not that unhappy about it, are we correct in imposing our Western values? And that is delicate and it requires a lot of forethought because you can injure people if you do an unwise action. So it's very difficult, but recognizing the issue is the first step.